Hello, everyone. All right, thank you for joining us today for our OHS expert panel where we're going to discuss returning to work during COVID-19. It's my privilege to be moderating today. My name is Nicole Orr. I'm an instructor in the OHS program at the University of Alberta Faculty of Extension. And joining me today, we have three other instructors from the OHS program, Christopher Spazoff, Carol-Ann Chung, and Ryan Davis. I think most employers and safety professionals are probably aware of the bulk of the contents of the province's relaunch strategy in order to get people safely back to work. But we're just going to quickly highlight some of the things that everybody should kind of already be doing in terms of integrating people back into their workplaces and offices. And of course, there's things like practicing good hygiene and doing thorough cleaning and disinfecting of our workspaces and aligning ourselves with Health Canada for using approved disinfectants and hand sanitizers and masks that meet Health Canada standards. We want to be doing our hazard assessments, obviously, to make sure we're recognizing COVID-related hazards and applying appropriate controls. And we need to understand what OHS is expecting of employers in terms of getting folks back into the workplace. We all know we need to support physical distancing, and that might be using things like plexiglass barriers or signage, floor markings, controlling the flow of traffic in the workspace. And then if we're thinking of hierarchy controls, our last option, using PPE when we can't meet some of those other control mechanisms. So maybe using masks or safety eyewear in that case. But today what we're going to discuss are some of the more nuanced elements of the plans and strategies that employers should have in place to get people safely back to work. And transitioning from the COVID lifestyles we maybe have been living at home and back into our new normal, whatever that's going to look like for us. So I'd just like to start by asking Carol-Ann, I know that a core area of your practice is performing auditing, and maybe you could talk a bit about what you've seen in terms of employer COVID plans and, you know, how it needs to extend beyond just that piece of paper with some strategies in place. Have you seen any gaps or areas where maybe employers haven't necessarily focused where they need to be?
Initially, I think employers were really putting together groups or having a designated individual who was reviewing pandemic information as it became available and then reacting to that. When they did get a final plan in place, I don't think that it has carried over into how does this impact other policies beyond a nice plan on a piece of paper. So there may be some things that have frequencies designated in your health and safety management system, like site inspections. Health and safety committees are having safety meetings. So if those things changed or the format that you were holding those things had changed, did you document the change? How did that get incorporated? Because if we are auditing, when was the start date of the change? Because it will alter how I'm going to look for documentation within your program. Did you review violence and harassment plans, especially if you've started to bring people back and you do interact with the public? So did you have a plan if someone came in and refused to wear a mask? How are you going to address that? Did you change things within your emergency response plan? So if you had designated first aiders or rescue personnel, do they still work there? Are they still trained? Some people didn't want to stay home or they couldn't stay home and work. And so they now could be the only person going to the office. Is there a working alone plan? Have you reviewed that with them? And then also confidentiality, document accessibility, document management, especially when working from home. And you may have other people now who don't work for your organization having accessibility to this information. So just even maybe reviewing confidentiality plans that should be put in place. Are you locking your laptop or your designated office at home when you do step away so that nobody can access that information?
Yeah, great points. And I think a lot of workplaces have found that they may have had to go through layoffs or they may have lost some people in the process, and have those gaps been filled in? And the people who held that information, does somebody else have access to it now? And are those activities being accounted for?
Exactly. If they were designated to somebody in the organization, is that still something that they are responsible for?
Mm-hmm. So building on that, Ryan, maybe do you want to talk about just relying on that plan? Is there something outside of that that employers should be thinking about when they're factoring into, this whole COVID situation, and getting folks back to the office?
Well, I think with the plans, you have to really focus on the contributing factors of hazards that are documented within those plans. So contributing factors of hazards include people, equipment, materials, and the environment. And I think the key thing to think about here is people. And what I mean by that is not just the staff that you're trying to protect and your workers, but also persons from outside that are coming into your business. And so Caroline mentioned, like, for example, a person that comes into your business and refuses to wear a mask. So what do you do? So you have that plan in place, but it really needs to be tested. And be realistic about the fact that, like, if you're working with, let's say, vulnerable workers or workers that are making like $20 an hour and those types of things, they may not be prepared in dealing with those situations. So the plan needs to be really clear, not only the what's on the paper, but it needs to be really clear to everyone how to actually manage that situation. We do have folks that are on just different levels of the risk tolerance spectrum. And so there are those folks, like Caroline mentioned, maybe have a high risk tolerance of what's going on. But then there's also people that have a very low risk tolerance that are more likely to report your business to the authority if they're not satisfied with the level of protections that you've been putting into place. So keep those things in mind, and then test those plans and make sure that the workers know what to do. It's fine to play out a scenario and have a discussion amongst the workers so that everyone knows what to do. And then also making sure that the workers feel psychologically safe and can report things to a manager if things need to be escalated.
Mm-hmm. I think an important element of that is training as well. When I think about the organization that I'm working for right now, and we put our return to work plan together, there's layers, of new things that you're introducing that you're expecting them to follow. And you can't just send an email and then expect everybody to remember and understand. You need to know, what are we doing? Why are we doing it? Why is it important? How am I supported in doing this? Because I think everyone can attest to, depending on, especially when you go out to various businesses, there's a lot of variance in how employers are dealing with their return to work strategies.
And I think that there's a really big educational component that ties into this, which is seemingly what everyone has sort of alluded to as well in this process. And, different businesses approach it differently, as you just mentioned. But what everyone needs to understand, general public as well, is that the steps that are being taken not only to protect the workers at that particular business, but also to protect the members of the general public that are actually frequenting those businesses. Since 2018, the OHS legislation here, obviously enough that all of these employers and businesses are subject to, includes an obligation to protect not only those workers, but to prevent hazards from emanating outside of the work site. And so in a lot of circumstances, these businesses are implementing those procedures as a means to try to respect that obligation and address that obligation. And unfortunately, in certain circumstances, get that negative feedback associated with, well, why are they requiring masking? And it suddenly turns into a political discussion or another hot topic, when really what those organizations are trying to do and should be doing is trying to control that hazard.
Absolutely. Yeah, excellent point. And maybe, Chris, maybe you can talk about that. Have you heard from any workers who maybe don't feel safe going back to work? And how does that align with the whole right to refuse element?
That's a really good question. And the work refusal provisions are certainly getting their fair share of attention throughout this pandemic, as they should be. But it's quickly become apparent that the change back in 2018 from refusals in what were known then as imminent danger situations, which were a defined set of circumstances, of course, to what are now dangerous conditions, which are not defined, have certainly led to some very interesting discussions and challenges for employers. The fact is that employers can institute policies and procedures to try and control the hazard that is COVID-19 and its spread. But as we all appreciate, they're never going to be able to eliminate that hazard entirely. And given its very nature, it's a hazard that some individuals, given their own predispositions, living arrangements, even how they get to and from the workplace in certain circumstances, are simply going to find themselves at greater risk than others. And as the relaunch continues to evolve, we continue to receive calls on a weekly basis about employers that are forcing support and other workers to come back into the office, including in some cases ones that would be considered to be high-risk workers, even though that there's absolutely nothing that would seemingly prevent them from working at home. And in very simple terms, that needs to stop. Employers in those circumstances are not only failing to adequately control the COVID-19 hazard and increasing the public risk, but they're actually putting themselves significantly at risk for work refusals. Given the situation that we're currently dealing with, there's no doubt whatsoever in my mind that COVID-19 constitutes a dangerous condition at the worksite, such that these work refusals would, if challenged, be justified. And similarly, there's no doubt in my mind that the way employers, quote unquote, remedy that dangerous condition is by having workers that are able to work from home. And the end result of this is whether employers implement the change or workers bring it about themselves because they don't feel comfortable coming back to work, is that workers that can work from home or work remotely should be working from home or working remotely. If it takes a work refusal for that to happen, the employer not only loses control over that entire situation, since essentially the regulator at that point will become involved, but it also opens the door to exposure of an entirely different variety.
Yeah, I think it's a good point, especially when employers are putting their return to work plans together, to consider that there will be special circumstances and you can't just broad brush and say everybody needs to come back. I know in the plan within my organization, we have put in provisions for people who maybe have pre-existing health conditions or they don't have childcare. You know, maybe their kids are not in school, but they cannot secure childcare right now. Maybe they live with a frontline healthcare worker that, you know, they need to limit their exposure. Maybe they're pregnant. You know, there's a number of different special circumstances that we have in our plan that we want to support people that maybe it's not right for them to come back to the office yet for varying circumstances. And I think employers need to consider and support that.
That's great.
Carol-Ann, I think this has been challenging for a lot of employers, obviously, and we've all kind of lived through the changes that we've had to implement here. But do you think there's any opportunities that we can glean out of this as OH&S professionals? Are there things that we can kind of benefit from, I guess, having experienced this right now?
I think this pandemic really does reinforce that with a safety career, we're going to be kept on our toes, not just legislative changes or changes to certificate of recognition documents, but this is how we can really look at hazards and controls and how are we going to respond for our organizations and our workers. This is the time to connect to your safety network or reconnect and have good conversations. There's lots of different industries out there. And so just to broaden your perspective outside of your industry, just to see some other challenges. There have been lots of webinars available, some at no cost or low cost, so you could jump into those. Or even connections like with Chris Spazoff, and he's running some safety meetings and really connecting that way, even if it's for half an hour, once a week with safety practitioners where we can have a good conversation. Keep up your own knowledge and skills, question things, challenge things, and you know, it's an opportunity to grow a little. If they don't have a business continuity plan at work, now's the time to figure out how to get something like that into place.
Yeah.
You know, further to that, I think one opportunity is for many of us that work in health and safety, particularly the generalists, we're familiar with I mentioned the four contributing factors to hazards. There's the four hazard categories of physical, chemical, psychosocial or psychological, and then biological. I think an opportunity here is it's made many of us alive to the biological quadrant of hazards, and all of us have gone through a fairly steep learning curve, like those that work outside of healthcare. And it's just like Caroline said, a really good learning opportunity, and to take advantage and weave some of these things into your business plans, like pandemic response and what have you. Because, like, let's get real, this is probably going to happen again.
Yeah, absolutely. It's interesting that you say that. It gives you the opportunity to kind of expand on your scope of understanding of a number of different things, and that's exactly true. As a generalist, we know a little about a lot, and this has really expanded, the things that we have to learn about. If you're not a hygienist or an epidemiologist, or someone that's really in tune with all of the nuances of something like this pandemic, it is a steep learning curve, but it's an opportunity to learn some new stuff too. Having said that, one of the areas that I've got to learn, crash course in is statistics related to the tracking of the virus and what that looks like in terms of workplaces. And I know, Ryan, you have a keen interest in statistics. You teach the OHS stats course for us at the Faculty of Extension. And thinking about that as a safety professional, how can we use some of that statistical analysis and data to manage our return to work safely, and where is it appropriate to integrate into that process?
That's a really good question. I think probably the first best answer is, when you're looking at data, is to rely on those things that are regionally or jurisdictionally specific. So here in Alberta, I take a look at the Alberta COVID website, and not only look at the provincial numbers, but also get into their interactive map and take a look at the region, like monitor active cases in Spruce Grove, for example, or in the Parkland County. So I think that's probably one of the most important things is to rely on and to trust the government data and statistics. They're going to be tracking it better than you can, probably. But also just always keeping in mind that data is meaningless without context, or put differently, you can give data more meaning with context. So the question to always ask is, out of how many? So for example, when we hear reports on the daily case count, like on Friday, 105 new cases, on Saturday, 173 new cases, 173 is, it's really, really trending upwards. But out of how many tests? And when you balance that out, the actual difference in positivity test rate is 0.1%. So it's just to make sure that you contextualize that, but then also keeping in mind, with exponential growth potential, not to underestimate the risk of a 1% positivity rate, which could very quickly turn into 2, 4, 8, 6, and so on, right? Mm. So I think that would be it, is just rely on the government data. And then internally, going back to I think your first question with going back to work, I would suggest, and I'm not an expert in epidemiology, certainly, and psychology, but I'd suggest one of the easiest, best ways, going back to the people hazard in assessing metrics, is to do some perception surveys. Get a kind of baseline of the level of risk tolerance and where your folks are feeling by doing a perception survey, and then use that information. It's very easy. Ask a few questions, scale 1 to 5, and get a gauge of where folks are feeling, and then where you can prioritize some of your responses.
Yeah, that's a good point. We've done that here. We've done a perception survey after we implemented our return to work to see exactly what the feelings were. And, in your head, you think one thing, but especially when you make it an anonymous survey, we had quite a spectrum of responses and some interesting observations, and it gives you the opportunity to tweak that and really improve things and maybe pull back in places where it's a bit maybe excessive and not necessary, and strengthen areas where maybe we didn't recognize that up front. So that's an excellent point. But I think that the big takeaway from there is, you can't just look at the new case count and then be like, with your hair on fire because it goes up. If they did almost double the amount of testing that they did the day before, then yes, you need to take that in context. So that's a really excellent point. One of the things I want to talk about, and Chris, this might be kind of a hot topic that maybe you can touch on here, but if there is a COVID related incident at work, and let's say, you end up with a case or five, or let's start with one case in the workplace. Do you think that should be reported as a OHS reportable incident via the PSI reporting system?
I am so glad that you asked that. You've hit on an issue that a lot, if not all, employers have been struggling with for some time now. That's been magnified 100 times over given the pandemic. This was an issue even before COVID-19 showed up on scene. That being, what actually constitutes a quote unquote potentially serious incident for the purposes of reporting to OHS. And if you really look at it, OHS has itself, I would suggest, struggled with defining that term, that PSI notion, and putting parameters around it. So much so that over the course of the past 2 years or so, they've actually revised their own instructions on what needs to be reported and what doesn't a handful of times. And currently, and unfortunately, the iteration that they're right now working off of, which was implemented just this past summer, isn't a whole lot clearer. So here is my take. If a worker tests positive and is admitted to hospital or dies, treat it as a true reportable, quote unquote, under Section 40 of the Act, and contact OHS. If a worker tests positive, but those qualifiers of fatality, admitted to hospital, aren't engaged, the question really becomes whether there was, quote unquote, the potential for the injury or incident to cause serious injury. Although the legislation itself now is quiet on how that's to be interpreted, OHS has interpreted it most recently to mean if under slightly different circumstances, there would be a high likelihood for serious injury. And then they provide this handy little flow chart along with the online reporting system to help you assess whether or not any given situation should be reported, such as the one you just suggested with one positive case. The problem is that those tools, as I'll call them, that they provide, first of all, contradict themselves. Secondly, require you to report hazards, or rather when hazards aren't quote unquote controlled, which essentially is reporting that you're offside of the legislation, and that creates a whole host of issues, legally speaking. And the third issue that I have with these quote unquote tools is that, taken at face value, they create a situation where you'd never actually have a PSI, since the controls had to have worked to some degree, or you would find yourself in a true reportable situation under Section 40. So when you try to add in the COVID-19 reporting requirement to that incredibly messy foundation to begin with, it's no wonder that so many employers are struggling with what to do, particularly when you actually try to report a COVID-19 situation via the online portal, and it tells you in most cases that you don't actually have to report it. So I want to be very, very clear. In the example that you gave, I don't see that as a PSI. I don't believe it needs to be reported as a PSI. In fact, I have yet to come across a situation where a COVID-19 related COVID-19 related incident would constitute a PSI or would be reportable to OHS. And to be completely honest, I have trouble seeing a situation in which it ever would. And that's notwithstanding that OHS is suggesting that these types of things should be reported as PSIs. I just don't see it. So I appreciate the fact that I'm kind of giving some conflicting advice here, because I'm stating something different than what a lot of employers are hearing from OHS. So for employers that are maybe struggling with that issue, here's the takeaway. Given the confusion, it's best that you assess each case on its own merits. And when you're doing that, you're doing it with a view to determining whether or not that particular case was likely contracted at work or elsewhere. And once you make that determination, you assess the particulars of that individual exposure and the risk factors or status of that individual involved, along with how many other individuals may have been subject to that same exposure, and then their potential risk factors. And once you compile all of that information, you can start to determine whether or not it's a PSI and needs to be reported. Now, keeping in mind that I've just told you I don't see it. By way of example, and I want to circle back to yours just quickly here, suppose that you have that one worker who tests positive, and you're able to trace it back to their interaction at a work site with, let's say, a third-party contractor. if that individual is showing only minor symptoms, which apparently the vast majority of people experience, if they don't have any major risk factors, for example, they're not immunocompromised, etc., and there's no risk for more workers to have been exposed, such as in an outbreak situation, I simply don't believe it's a PSI or necessary to report, even though a control very well might have failed in some sense to allow it to happen. Okay, although to be completely clear, you should still be investigating it, but I suspect that that goes without saying. Unfortunately, each one of these cases is going to turn on the specific facts of the exposure. So I'm not going to be able to provide a nice hard and fast rule, but those are the types of things you need to be thinking about and really need to look at what the legislation says on it.
Yeah, I think part of that is that whole contact tracing piece, right? If you don't know where that was contracted from, that could have been from the grocery store or going to as we've seen in many cases, some sort of gathering, right? A wedding, a funeral, a worship service, wherever. If you can't unequivocally equate that back to the workplace, then it would be quite difficult to say, oh yes, they got that here. It's one of the things we talk about here is, we have lots of good protocols and things in place here, but what you do when you leave here really has an effect on everybody else too. And we have to be really mindful of how we behave when we're not here. So to extend that question, Chris, what if, I think the answer is kind of probably self-evident now, but if there was an outbreak at a workplace, that's a little different, right?
Yeah, I would say that when you're in that sort of a situation, that's the one that really red flags it for me, right? And whether it's red flag pursuant to the legislation or whether it's red flag because you don't want to have a situation that some other employers are going through right now, you want to basically bring that to the attention of OHS. You'll have already brought it to the attention of AHS and probably to a bunch of different organizations and outlets already, but you want to really gain as much control of that situation as you possibly can. So the outbreak type situation is definitely a red flag for me and would change the insight and the approach that I'd be recommending my clients take.
For sure. I guess just a question for everyone. And I think one of the things that we've seen, and certainly as globally, one of the effects of this virus has been a vast effect to mental health, and not only in the workplace but broadly across every kind of aspect of our lives. I remember reading a statistic, and this was back in April, so not long after we had embarked on this bit of craziness here, that the sales of alcohol had increased by 150%, so obviously there's people having some trouble coping, and we may see the spill effect of that into the workplace. What can we do as OH&S professionals to support the mental health of our workers as they're trying to integrate back into this new normal and all of these things that are layered on top of us in terms of stressors? What can we do to support that? And I'll just open that up to anybody.
I'll go first. So maybe it's time for employers to consider sending some staff for mental health first aid training. This is through the Mental Health Commission of Canada, and this is beyond that first aid, so cuts and all of that at work, and use them to help integrate people back to work. I think it's time to review the employee assistance program, even if it's as simple as sharing how can we access it, who are the providers for that. And if you really are struggling with certain aspects, maybe reach out to organizations that can help you. Something like Stop Abuse in Families, they have great resources about policies and how to talk to your people on even getting them a referral or seeking outside help. And be flexible. We all have personal lives and we're all going through this very, very differently. Reinforce those harassment plans, especially for online meetings. We're still in a work environment.
Just to add to that, I'd say the whole world has been dealt an extraordinarily bad hand. And I think, generally speaking, especially in Canada, everyone's been playing this bad hand relatively well. Like our government, regardless of your political affiliation, both provincial and federal government have responded as best they can. Businesses are responding as best they can. Us as citizens, for the most part, the overwhelming majority are complying, washing hands more often, wearing masks where appropriate. So just keeping that in mind and having compassion for people. Like Caroline said, we're all dealing with this in different ways. When people ask me, hey, how's it going, Ryan? I say, well, good, all things considered. I always add that qualifier because we're all going through this. So, but for us as health and safety professionals, I think it's really important that, again, as Caroline was mentioning, businesses and individuals are going to be relying on our leadership as health and safety leaders, and to take advantage of some potential training opportunities right now. The University of Alberta has courses on psychological health and safety and is building a certificate program, to my understanding. Additionally, the University of Fredericton has a partnership with the Workers' Compensation Board of Alberta for a deep reduction. I think it's 70% discount for some of their training, a certificate or a diploma program through them. So look into those opportunities and add more psychological health and safety training to your toolbox, if you will, because there's going to be a great need for, again, individuals and employers for assistance with this.
Yeah, and I think just to add to that, the role of the health and safety professional is really changing, and it's really been expanding over the course of the past several years. And this notion of psychological well-being, social well-being has really hit home here in Alberta in the past few years, but this pandemic has really brought it out. And I think by and large, employers, health and safety professionals and the like, everybody's been really good at the physical side of things for a really long time. But wrapping our minds around this psychological, this sociological aspect of things is a little bit tougher. And one of the things that I see as counsel a lot is I see efforts that employers and health and safety professionals are sort of putting in place geared towards tackling that psychological well-being, that social well-being. But in a lot of circumstances, they're reactive and they're responsive. They're not proactive. And so if there's one piece of advice that I can leave with on that particular topic, it's to look for areas outside of the box that aren't simply, well, we're going to make sure that nothing bad happens here at work to negatively impact psychological well-being or social well-being, but actually go beyond that and say, we want to encourage positive psychological well-being, positive social well-being. So we're going to implement steps to make sure that we can actually bring about positive changes in that, not just prevent the negative, but actually encourage the positive.
And I think part of that is transparency with the workers too, right? Involving them in the decisions and how you got to those decisions, not just, okay, this is what we're doing, you're going to do this, this, and this, March. We've got some input and feedback and some transparency in how we got there. So what are some of the things that you're hearing from employers, Chris, about returning to work, the concerns from employers? We talked about the work side, the workers. What are some of the things or questions you're getting from employers?
Right. I think, the most common one that I've been receiving, and this is almost on a daily basis, is whether or not the employer is required to provide the cloth face mask or the face covering to employees, or if employees should be expected to source their own. In short, the answer to that is no. Employers are not required to provide cloth face coverings or disposable masks to their workers unless there's something in the collective agreement that would require them to actually do that. Now, I raise that topic because, as I say, it's the most common question I'm receiving by far as of late, and I've seen some very interesting answers to it. Now, some people have suggested that the reason employers don't need to provide them is because they aren't considered PPE or true personal protective equipment, but I don't agree with that assessment. The definition of PPE is incredibly broad under the legislation and would in fact capture cloth or disposable face masks. That's not the reason. The reason is simply because there's nothing in the legislation that contemplates the use or really the existence of this type of a mask for this type of a hazard. I mean, keep in mind there's no OEL or occupational exposure limit for COVID-19, and that the majority of employers outside of those working on a vaccine or handling the virus in that sort of context, it's not an airborne biohazardous material. And so none of the sections in the legislation that speak to those things apply. And so there's no requirement there for employers to provide that or to source that for the employees. The one thing that they really do need to be alive to, however, is that they can't simply wash their hands when it comes to masks. If their hazard assessments identify mask use as a control, then there is an obligation on the employer to make sure that the masks are actually worn, that they're of suitable quality, and that workers know how to put them on and care for them, right? None of this wearing it underneath the nose stuff that we see all too commonly. All of that, of course, is fleshed out at the start of Part 18 of the code. So, is it a requirement for employers to provide them? No, there's not. But in certain circumstances, because of these additional requirements on making sure they're of suitable quality, et cetera, what you're seeing is some employers doing exactly that, but it's simply being done as a means of quality control. There's no legislative requirement for them to provide that.
Do you think it's fair to say, though, that employers could treat it the same way they treat hard hats? Most employers, even though it's not a legislative requirement for them to supply it, they do, because it's easier to manage that control, right? They're getting a compliant piece of PPE if you're supplying it. It's easier to then monitor the use of it. Would that be kind of a fair thing to say? It might not be legislated, but much easier to create that safe work environment.
No, 100%. And that's exactly what a lot of employers right now are struggling with or wrestling with, because that's how they're determining they can go about maintaining that quality control and making sure that they're actually appropriate for the intended purpose, so to speak. But it actually touches on one other aspect of things. And so you raised the reference or made the analogy to hard hats. You could also make it to winter boots, for example, right? We live in a winter climate. Now, there's no obligation on an employer to provide winter wear or winter boots. That's simply not covered in the legislation. But knowing that your workers are going to face that hazard, it creates a really interesting situation when you go back to something that we talked about a little bit earlier, which is that right to refuse work in the circumstances of a dangerous condition. And so what I've seen on a few different occasions now are workers looking at a situation where the employer has identified the need for masks as a part of their hazard assessment. They've said, yep, we've got to have that type of a control. If you are in that environment, you have to have one. We as the employer are not going to provide it to you. You have to bring your own. And what I've seen some workers do is exercise that right to refuse unsafe work in dangerous condition situations, saying, hazard assessment has identified that I shouldn't be here without a mask. I don't have a mask. Employer is not providing me one. It's a dangerous condition. I can't go to work in that set of circumstances. And so it becomes a very interesting discussion and a very interesting analysis once that right is engaged, because at that point, to a large extent, the employer loses control over it. So in certain circumstances, you're seeing employers provide masks as well, even though not legislatively required, but because they've done the math on it, gone through the economics, et cetera, and determined, you know what, we can afford to provide this particular piece of PPE to our workers. That's within the budget that we've got. It just makes sense for us to do it, and we're not going to then run the risk or have to deal with a number of different work refusals, which are going to take us down an entirely different path. So it's definitely an interesting conversation on all fronts when it comes down to the masks.
Yeah, for sure. I think just for our final kind of round table here, maybe we can each touch on some things that you think are some key strategies that health and safety professionals and employers should be thinking about to ensure a safe return to the workplace. And anything that maybe we haven't touched on yet that you're kind of passionate about, or that you've seen that hasn't, if you're seeing gaps, or maybe there's just not a high level of understanding that you want to talk about. Ryan, I'll start with you.
I guess this would go back to a previous question about opportunities. And with this, again, it's a terrible situation, but many employers have their operations slowed down. And so maybe perhaps take the opportunity of looking at your processes. I love the grocery store example. When you walk in and now it's like a board game, and there's arrows that tell you where to go, and it's controlling the flow of people. And yes, that's for our protection for spacing and what have you, but it's also like operationally more efficient if you're like monitoring the flow of people. So like look at how things or processes or people interact and flow through your organization, and then take that opportunity to improve some processes while we're already dealing with this. On that note, there has never been a more opportune time to make improvements to your health and safety program and your health and safety management system. Bennett Jones wrote an article about this earlier on in April, I think it was, in their blog. Like take this downtime as an opportunity to improve your program. And well, it's time, the clock's running out, but until the end of the year, for purposes of the certificate of recognition or core, all audits, including certification audits, are documentation only. There has literally never been an easier time to get a certificate of recognition. And for those employers that do have one, a very recent announcement from the certifying partners, all the safety associations that administer and manage core, is that internal auditors can conduct an audit for certification purposes for the first time ever. That's never been a thing. And for those audits that would be done doc only from an external auditor, they could be good for 3 years, provided you're in your second cycle. So if you're already a core holder, for example. So take advantages of those opportunities while they're there, and just, again, continual improvement on your program and your processes.
Mm-hmm. Yeah, good points. Caroline.
Just continuing with what Ryan has said there, don't just wait for that once a year review and management sign off. If we've had a situation where an employer has downsized and in that layoff was safety personnel, they need to find out, how are we accessing the documentation? How is this organized? How are we making it available to anybody who's required to look at it? So really coming back to that internal responsibility system, and are all levels engaged in this program and system? Also check good sources of information, really find out where you're getting your information from. And early on, the World Health Organization Director General said, detect, test, treat, isolate, trace, and mobilize. This is what we do in safety, so it's really time to come back to those good safety practices throughout the whole health and safety management system.
Mm-hmm. Excellent. Chris?
Totally agree. And at the risk of basically repeating what both of my colleagues have already said, I think it's incredibly important to recognize those things, because it's completely legitimate. We're at a very interesting time right now where there's not only an opportunity to change over health and safety systems, protocols, policies, et cetera, because the opportunities presented itself, but in a lot of ways, it's actually necessary to do that. And you're dealing with a hazard that, Caroline mentioned different levels in terms of the internal responsibility system and that aspect of things. And I think it's a really good point, because the hazard is one that everyone at every single level of the organization has to be alive to, has to be dealing with, and is affecting them on an individual level. It's not just the top looking down saying, well, this is affecting people that are out there in the field, or the bottom up. This is throughout the entire organization. And so the only thing that I'll add to what Ryan and Caroline have already said is, I'm a big proponent, if you haven't already, of establishing a COVID-19 committee, regardless of whether or not you already have a health and safety committee or representative, or one or more health and safety professionals. They're going to need support. And it's simply unreasonable and, to be quite blunt, disingenuous to simply expect them to address COVID-19 as though it were any other hazard. It's not. I mean, we're dealing with an unprecedented situation where new information is constantly coming in. I mean, shout out to Reddit. Some of the best information that I've got has come off of Reddit, followed up after the fact, of course, because you never know what you're going to read on there. But the landscape and the potential risks are constantly shifting. And you need a team. You really do need a team approach, both in terms of your COVID response and in terms of your organization, that's going to be able to immerse themselves in that knowledge. I know I'm not alone in terms of sitting here on Friday nights, Saturday nights, leafing through the phone, looking at the new COVID-19 and kids article, or COVID-19 and this article, et cetera, right? We're all doing it. We need to put ourselves together, bring all of that information, make sure that we all understand it, understand what's happening, track the people that we're working with, and then make sure that everyone is on the same page with that information, that all workers are sharing in that, okay? And all workers are alive to the preventative measures and steps that, as an employer, as a health and safety professional, we're putting into place in order to respond to that. But I think that the points about taking the opportunity, seizing the day, and staying educated, immersing yourselves in it, totally rings true. And I find it interesting that we're all on the same page with that approach. So I'm going to flip it back to you, Nicole, and ask you for your thoughts on that.
Well, it's interesting, the point that you made about having a team. The organization I'm working with, we have a pandemic response team, and it's a mixture of people from different backgrounds. You know, obviously there's the HSSE element there, but we have people from HR involved and responsible care and engineering, you know, just to give all of those different viewpoints in terms of how we can best approach this and looking at it through different lenses, which I think is really valuable. Our team has shrunk a bit through, you know, attrition of staff, but that's definitely a good point. I think the other thing that I would say is building on what Carol Ann said, referring to legitimate sources as guidance. You should be starting, if you're working in the province of Alberta, with the Alberta government relaunch strategy and what their requirements are to get people back to work safely. But I mean, also things like I find that some employers are missing out on the basics where, for example, they're allowing staff to use like the ski buff, you know, the one layer kind of thing you wear around your neck and you just pull it up as you need to, does not meet Health Canada requirements. So for the purpose of a workplace, it doesn't cut the mustard. It has to be, you know, if you're using handmade or homemade masks, fabric masks, they have to be at least 2 layers. And I know we wrote into our plan here, they need to be 3. So you need to have a filter of some sort in there too. Thinking about the good sources of guidance, even when, you know, we were trying to source things like disinfecting wipes and hand sanitizer. They're a little easier to come by now, but when it was really hard, everybody and their dog were like, we got wipes, we got hand sanitizer, but a lot of them did not meet the criteria on the Health Canada website. And, you know, we would check them all out, and some things we couldn't purchase because they weren't approved and they didn't meet the criteria. So using those things as guidance to make sure that you're implementing the right things, you're actually doing helpful things, not maybe harmful things, in how we get people back to work safely, and then really trying to support people in that the best way we can. I know when it was hard to even find masks, just giving people sources that if they want to source their own, that they can. But doing that to the best of our ability, and exactly, I think as Carol Ann said earlier, building and relying on our communities of people. You know, you guys as my colleagues, you know, we've had many discussions outside of this venue right here about all things related to COVID and how are you dealing with that and what does that look like, and that's really useful too. So turning to each other, because I think our community of safety people, we need to always be building each other up, right, and supporting each other, so collectively we're providing a good service to, you know, everyone that we serve. Just want to thank everybody for their input today and taking the time to have this important discussion. I hope this was helpful for anyone who tunes in and gives you some ideas and thoughts on how you can safely return to work, and maybe some things that you can do to make the workplace a little bit safer as we all go through this difficult time. So thanks again, everyone. Thanks very much, and we'll see you around.
Thanks, Nicole, for moderating, and for the University of Alberta for hosting this.
Absolutely.
Exactly. Thanks, team. Take care.
Take care.